Hello and welcome to my video on shoulder special tests. Today we are going to discuss each special test. We'll start with the impingement tests, then move on to rotator cuff tests, and finish with instability tests. Let's get started. The shoulder is the most mobile and also the most unstable joint in the body. Special tests help identify conditions like impingement, rotator cuff problems, biceps tendon issues, labral injuries, and instability. These tests provide clinical evidence and are not standalone diagnoses. Now we'll move on to impingement tests. The near impingement test is designed to identify subacromial impingement, often involving the supraspinatus tendon or the long head of the biceps. To perform the test, as you can see in the illustration, the examiner stabilizes the patient's scapula with one hand and passively flexes their arm fully into flexion with internal rotation. A positive sign is pain at the end of this movement, which indicates impingement of the underlying structures. The Hawkins-Kennedy test is designed to detect subacromial impingement, particularly of the supraspinatus tendon. To perform the test, the patient's arm is flexed to 90 degrees at the shoulder, with the elbow also bent to 90 degrees, as illustrated in the image. Then, a forceful internal rotation is applied. Sharp pain is a positive sign and indicates impingement of the supraspinatus tendon. Now we'll move towards the rotator cuff tests. The empty can or Job test is used to evaluate for supraspinatus pathology, such as tears or tendinopathy. As you can see in the image, the procedure involves elevating the patient's arm to 90 degrees in the scapular plane with the thumb pointing downward as if emptying a can. Then, the examiner applies a downward resistance. Weakness or pain during this test indicates supraspinatus pathology. The drop arm test is used to check for a full thickness supraspinatus tendon tear. As illustrated in the image, the examiner passively abducts the patient's arm to 90 degrees. Then, the patient is instructed to slowly lower their arm. A positive sign is if the arm drops suddenly or if the patient cannot control the descent. The lift-off test is used to check for a subscapularis tear. In this test, as shown in the image, the patient places the back of their hand against their spine. Then they try to lift their hand away from their back. The therapist may provide some resistance if needed. Weakness or inability to lift the hand is a positive sign indicating a subscapularis lesion. The belly press test is used to check for subscapularis involvement. As shown in the image, the patient presses their hand into their belly with their elbow forward. The examiner should look for the elbow dropping backward. If the elbow drifts posteriorly, it indicates weakness of the subscapularis muscle. Now we'll move towards the instability tests. The apprehension test is used to assess anterior shoulder instability or the risk of dislocation. In this test, as shown in the image, the patient lies supine, while the therapist abducts the shoulder to 90 degrees and gently applies an external rotation force. A positive finding is if the patient feels apprehension, fear, or resistance to this movement, indicating anterior instability. The sulcus sign is used to assess inferior or multidirectional instability of the shoulder. As shown in the image, the patient's arm is relaxed by their side, and the therapist pulls the arm downward. A positive sign is the visible sagging of the shoulder, creating a sulcus or gap below the acromion, which indicates ligamentous laxity. Now we'll move towards the biceps tendon tests. Speed's test is used to check for biceps tendinopathy. As shown in the image, the procedure involves the patient flexing their shoulder to 90 degrees with the elbow extended and the forearm supinated. The examiner then applies a downward resistance while the patient tries to maintain the position. Pain in the bicipital groove is a positive sign, indicating bicipital tendinitis. Yergason's test is used to assess the stability of the biceps long head tendon in the intertubercular groove. In the image, the patient's elbow is flexed to 90 degrees and the forearm is supinated. The therapist applies resistance to supination and flexion, and a positive sign is if there is pain in the bicipital groove. Thank you for watching this video. I hope it was helpful, and we will meet again with a new topic. Goodbye.